Hey everyone, welcome back to Amize Health. I'm Dr. Thorpe Amize. So happy to have you join me tonight. For those of you who are on Facebook, unfortunately, I had to create a new live video. So thank you for bearing with me and joining me this evening. So this month, I've been talking a lot about high cholesterol. And so it's one of those things that is so critical for us to manage in the office that I thought that it was something that we should talk about also because a lot of patients come in not understanding why, when they have diabetes or when they have high blood pressure, why are we even putting them on cholesterol medicine if the cholesterol isn't reported as being elevated, or they don't understand what elevated cholesterol has to do with managing their health. And so I wanted to go into kind of what the risk factors are for why people have high cholesterol, or what kind of comorbidities or other illnesses exist in conjunction with high cholesterol, and then talk about some of the symptoms that happens with that, and then ways that you can modify your diet. Now, I completely understand that this is not going to apply to everybody, right? This is for general understanding of high cholesterol and how to decrease it. If you are in a category where this, you feel like this doesn't apply to you, or you have special circumstances happening, then I would implore you, encourage you to go ahead and schedule an appointment with your primary care doctor, because they know your numbers, they know what's going on with your health, and they are going to be the best ones basically to assist you or to answer your questions. This is really general information, like I said, and seeing if I can answer any of the questions that you have. Otherwise, I'll be directing you over to your primary care doctor. Okay? So let's get started. So, one of the things that I wanted to just mention is that um, lowering your cholesterol actually has one of the greatest benefits compared to all the other risk factors combined, to, in terms of high blood pressure, diabetes, all of the other things. Lowering your cholesterol, many studies have shown that it can increase your lifespan. So what is it about cholesterol that we're not getting? Like, what is it? So I just want to break down some basic things. So there are saturated fats and then there are unsaturated fats. So some saturated fats, it includes a type called trans fats, which, if you this one of the simplest ways to think about saturated fats is, does that fat or stay solid at room temperature? So things like butter are solid at room temperature, right? Olive oil is not. So in when you're trying to think about one versus the other, saturated fats tend to be fats that stay solid at room temperature. Unsaturated fats are liquids at room temperature. And so the unsaturated fats are going to be the ones that are less likely to clog your arteries. Whereas the ones that are solid at room temperature, they're going to be sitting, making fatty deposits in your blood vessels, which can then lead to atherosclerosis, which is basically hardening of the arteries. So now, under the umbrella of unsaturated fats, there's polyunsaturated and monounsaturated. We often say that polyunsaturated fats are better. And really, the reason is that there's been studies showing that if you replace your foods that are high in saturated fats, if you replace those with polyunsaturated fats, then you can reduce the risk of heart disease by 19%, almost 20%. So, I mean, that's pretty significant. So, making those kind of changes really can have a dramatic impact on your risk for heart disease and ultimately your long-term outcome. So, those were the main things that I wanted to go through. So then when we talk about getting your cholesterol checked, there are specific things that are checked on your lipid panel, and those things are your total cholesterol, your HDL cholesterol, which traditionally has been known as the good cholesterol, and your LDL cholesterol, which traditionally has been known as the bad cholesterol, and then your triglycerides, which also is another type of um, fat that, if elevated, can cause clogging of the arteries. So those are the main ones that we're looking at. There are some others that are, typically on your lipid profile, but those are the main ones that we like to talk about. So those are the ones that I wanted to focus on. And in essence, when you have high cholesterol, another term for it is hyperlipidemia. When you have that, that's often um, that's often because there's an abnormality in your lipoprotein metabolism, which basically is the processing of your fats, right? And the fat breakdown is abnormal. That's the simplest way that I can put it. So if you have high cholesterol or hyperlipidemia, that could be an elevation in your total cholesterol, your triglycerides, your LDLs, or a deficiency or a lowering of the HDL cholesterol. Now, sometimes some of the questions that I get asked about cholesterol is, well, what should it be? What is normal? So your total cholesterol really should be less than 200. That's where you want that to sit. For LDL cholesterol, like I said, the one traditionally known as the bad cholesterol, optimally you want it to be less than 100, especially if you are someone who has diabetes or heart disease. um, you're close to being optimal if you're slightly over 100, meaning less than 129, but optimally we want you to be less than 100 for that. The For HDL cholesterol now, we want you to be above 40. So anything below 40 is considered a deficiency in HDL cholesterol. This one, usually we want it to be a little bit higher, and it's considered the quote unquote good cholesterol because if it's a little bit higher, it can lower your risk of heart disease. So the higher the number, the lower your risk. Generally, we're looking for around 60 or above. So anything above 40 is good. And then the other one, which is the triglycerides that I mentioned earlier, triglycerides, if it's higher, you can increase your risk of heart disease, and you generally want that to be less than 150. Sounds good. So we have our numbers. This is what we're working with. This is what's on our panel. That's what the types of fats are. Now let's get into what the risk factors are. And these are things that like I mentioned before in the previous videos, are risk factors include having diabetes, having chronic kidney disease, having hypothyroidism, which means lower, and then obesity. So obesity tends to be defined as a body mass index that's greater than 30. And then if you are someone who have a sedentary lifestyle or a poor diet can include having a lot of animal fats, or you're a smoker. Those are all things that increases your risk for developing heart disease or developing hyperlipidemia. Now, things that we can't really do much about in terms of our risk factors, we can do things to try to decrease it. But if you have a family history of cardiovascular disease before 50 years of age in a male, or 60 in a female, that's a higher risk factor. So we want to screen men who are greater than 35, and then for women greater than 45. But most people who come into the office and get physical done, we're gonna go ahead and check your cholesterol levels, especially if you haven't had them checked either ever or in a long time. So generally, we want to make sure we check those levels. That really is the primary way that you're going to know if your cholesterol is elevated, is if we check the levels. So we would be taking blood. And when we say come in fasting when you get your blood work taken, usually that it's for the cholesterol check. Okay. So that's the main reason why we want you to be fasting, because sometimes if you're not sometimes, if you're not fasting and you have like a heavy fat meal, it's going to skyrocket your triglycerides likely. And so it's not as good of a test if you're not fasting. So we can still get information from it. So it's not to say that it won't be useful, but it is more useful if you fast before getting that done. Now, some of the signs and symptoms, like I mentioned before, you may not have any symptoms initially, but you can develop elevated cholesterol over time. And if it's unchecked, meaning you're not doing anything about it and it's just elevating without you knowing, then you can develop symptoms. And those symptoms can manifest in ways that, like I mentioned before, heart disease. You can have some less left-sided chest pain or pressure. Now, someone had sent me a question about this, like, oh, I'm having chest pains, and the chest pains make me feel dizzy. That is something that you need to be evaluated for right away. This is not something to play around with. This is not something to wait for. If you are actively having chest pain, go to the emergency room and get evaluated, okay? Because that is a serious thing. And the only way to know what's going on is if you go and get evaluated. So I would implore you to go ahead and do that. Now, the other things that it can manifest is like stroke like symptoms. You can have unsteady gait or slurred speech. You can have atherosclerosis or a buildup of these fatty deposits in other vessels throughout the body, and those can lead to other types of symptoms depending on where they are. So those are really the main things. Like I said initially, you may not have symptoms, so you may not know your cholesterol is even elevated. I'm going to take a quick pause, see if any of you have any questions. And once again, thank you so much for joining me today. I appreciate you joining me. I'm here on Facebook Live and on YouTube Live talking about elevated cholesterol. And so far, we've kind of gone through what cholesterol is, what the elevation, what normal is, and then what abnormal looks like and what it can cause. So now in terms of things that you can do, and again, I got a comment about this one with people who are doing keto diets, specific diets, depending on what you're doing. um some of these things may need to be modified. However, these are general and overall should help to lower your cholesterol. And my recommendation generally is, if you have a lot of questions about how to make changes to your diet, or if things that I'm saying to you either doesn't make sense or you just need more information, one of the things that you can do, one, you can ask your primary care doctor. They may or may not have the time to go into detail with you about it. But if they don't, one of the recommendations that they can make is for you to see a dietitian. And we lean on our colleagues in that area a lot when it comes to these kind of things, because they can get into the very specifics with you about ways to modify your diet. And I think that if you are someone that is concerned about it and you're willing to make modifications and see a dietitian, you absolutely should. Okay, so that is an option that's out there. So things that you can do to modify your risk factor or decrease your cholesterol. I mentioned exercise. I always talk about exercise because keeping it moving is always going to be beneficial to you on so many different fronts. And cholesterol is no different. Exercising helps. Quitting smoking, if you are a smoker, helps. Those things will help to increase your HDL. Remember the good cholesterol level that we want to be over 40? That will help. Now, in terms of the specific foods, you want to decrease foods rich in animal fats. And I said this before, minimizing saturated fats. So, like red meats, full fat dairy. Um, you want to avoid the trans fats. Remember, we talked about that before. Those are the things that can sit at room temperature and be solid. Like margarine, they tend to be in like store-bought baked goods, things like that. So you want to consider replacing some of those saturated fats in your diet with monounsaturated or polyunsaturated fats. Um, so although saturated fats aren't unhealthy, or you want to swap them out, because swapping them out means that you would lower your cholesterol level. So to lower your cholesterol level, in order for me to clarify that, you want to switch over to unsaturated fats, okay? The ones that are going to be liquid at room temperature. Then you want to eat things like beans. That's going to help you to feel full longer. It's going to help to bind the LDL and bring it down, so decreasing your LDL levels. You want to have fish that are high in omega 3s. It helps to reduce your triglyceride levels. Nuts such as almonds, walnuts, pistachios also help to decrease your LDL levels. These are all things that you can modify in your diet to help your cholesterol. Like I mentioned before, decreasing your cholesterol level actually has a great overall impact on your health. So, that is a lot of information, and I kind of just went through a quick summary of all the things that I talked about over the past 3 weeks. So, what questions do you all have for me regarding this? And I'm going to be checking the comment section. So if you have any questions, feel free to place them in the comments. If you are on YouTube live and you don't have the ability to place a question there, you can always send me a message on Facebook Live. You can comment there, or you can send me a direct message on social media, and I'll just be continuously checking that just to see whether or not there's any questions that I can answer for you there. Now, once again, I thank you all for joining me this evening. And I am so grateful that I'm able to provide you with the kind of information that's going to be useful to you. So, the only way for me to do that is to get feedback from you. So, go ahead, ask your questions. I'm going to go ahead and start checking to see whether or not you all have posted anything on any of my other social media platforms. Okay. So, again, as I wait for questions to come up, I want to say that, at the end of the day, I'm here to not only help you, um, I'm here to see how we can best walk through a healthy life, right? I get so many patients that come in that don't have an understanding really of what is going on with their health. And so the best thing that I can do is educate you. Now, again, I understand if some of you have the ability to get your questions answered, or Dr. Google is your best friend and all of that. I'm just here to help in the way that I can, and I think that sometimes people are afraid to ask the questions because they're either shy or concerned about how it might look or how it might sound. But let me tell you, that's precisely why I'm here, because sometimes when we're in the office and we're seeing you in a patient visit, um, for one reason or another, we don't have a lot of time to dedicate to answering your questions. And so, because of that, sometimes a lot of people say that they leave the doctor's office feeling like they didn't get their questions answered, or they didn't get to ask all that they wanted to ask. And I hate hearing that. So I decided that this may be a good way for me to try to help to answer some of those questions, because some of the things that come up, they come up so often. So if you're wondering how I'm deciding on some of these topics, it's because they're coming up very often in the office. And I really want to make sure that we as a people are are getting answers and are looking after ourselves, so that we can stick around and be here for our loved ones, and be here and show up and as our best healthy selves, and whole selves. So in order to do that, we got to take care of ourselves. You can't just do whatever you feel like doing or eating whatever you feel like eating. And I know that in the moment when you're approaching whatever it is you're about to eat, it feels good in the moment, but not everything that feels good is good for you. So let's find ways to start moderating what we eat. So I'm not saying you can't ever have anything. I'm just saying let's moderate it. Let's cut down. Let's do better, right? Let's do better. And in our doing better, we can teach our children and our grandchildren and all of that to do better also. So let me just see here if there's been any questions that popped up. And one of the other things that came up, I'll say that I received a question about before, was when someone asked, when they have symptoms that come up and their doctor is not available, what are they supposed to do? Now, some of the symptoms that I mentioned before, like chest pain, if you start having blurry vision, if you start having slurred speech, if you're having dizziness, those are all things that need to be emergently handled. So that means going to the emergency room. Um, there are other things that, you might, like, for instance, not necessarily having to do with the cholesterol, but if you have a rash may or may not be an emergency. So I think that that's where telemedicine is useful if you have access to telemedicine, is that if you have a question about whether or not you should get seen, then that's a good way to kind of ask the question. But for those critical things that I mentioned, go to the emergency room, please, and get that symptom or whatever that thing is addressed. Now, having consistent appointments with your primary care doctor, whether it be your once a year annual visit, or if it's, some people need to go in twice a year, some people need to go in every 3 months. It really depends on what's going on in your health. And I've heard a lot of patients say, oh, doctors are just trying to take my money, that's why they want me to come back so soon. No, we're trying to keep you healthy. So if you are someone that has diabetes or high blood pressure, we might need you to come back sooner, because we want to make sure the medicines are working. If you're placed on medications, if you're not on medicines and you're just doing diet modification, we want to make sure that that's working too. So it's checking on you to make sure things are going well. um so that's why we have you come back at the intervals that we have you come back at. So one of the questions here says, hello doc, whenever I hear cholesterol, it's usually associated with something bad. Do you think we can eliminate consuming bad cholesterol completely? Absolutely not. That's a great question. That is a great question. And an extension of that question says, if not, should we be concerned if we still consume some bad cholesterol but have good cholesterol levels? So there's no way for you to eliminate from your diet completely one form of cholesterol or another. So our bodies require fatty acids. So it's not just that, how's the best way to put this? So it's not just that you shouldn't have fat. Like, for instance, you shouldn't have cholesterol at all. Our bodies require it to function. So you absolutely will have food with cholesterol in it, and some of it may be what we call good cholesterol, some of it may be what we call bad cholesterol. But I guess that the ultimate thing that I'm trying to say is, you can eat what you're eating and have cholesterol, but the key is minimizing the bad cholesterols. So for instance, when I was talking about like foods that are with trans fats, you want to decrease the trans fats in your diet. You want to decrease the saturated fats in your diet, because those things will increase your risk for heart disease. Now, you still need, just like I mentioned before, you still need good cholesterol. So you're in a lot of foods, you're going to get a mixture of those things. It's just that you want to get something that has a higher proportion of, like, let's say, good cholesterol or omega-3 fatty acids. You want to get something that's going to have higher proportions of the things that you need, rather than the things that you don't. In everything in life, including cholesterol, it's about moderation, balance, right? Everything is about balance. So you net you we're always trying to make sure that we're not tipping the scales in the wrong direction. And so if your diet consists of a lot of processed foods, animal fats, a lot of baked products that you're not baking yourself at home and controlling the ingredients, if those are the kinds of things in your diet, then oftentimes you're going to have someone who is likely having problems with their cholesterol, possibly having problems with their weight, things like that. So we want to make sure we're doing things in moderation and with balance. So I hope that that answers your question about eliminating bad cholesterol. So we always talk about making sure that you're eating fruits and vegetables, making sure that you're eating grains. You know, I don't know if many of you remember when you were a kid, or if you don't, at any point in life, remember we used to talk about the food pyramid. That's really something that we need to like think back on and re-implement in our lives, because in the with the food pyramid we have specific types of foods, right? That you're supposed to do certain quantities of each food from each food group. And so that I think is where we should kind of try to go back to really understand, or to really have a balanced diet. So again, nothing is necessarily um I'm not saying that you shouldn't have anything that, or that you should cut everything out of your diet. I guess that's a better way to put it. I'm not saying cut every single thing out of your diet. Don't enjoy anything. I would be like a Debbie Downer if I said that, right? No one would agree with me. No one would do what I say. None of my patients would follow what I'm telling them. No one would have their A1C under control and diabetes. Their cholesterols would be out of control if they didn't listen. So all things in moderation, and I'm all for making sustainable changes over time, because sustainable changes over time is what's going to be most beneficial for you, right? I am very much pro sustainable changes. And what I mean by that is when you make small changes to whatever it is that you're doing, that you can continue to do and continue to implement to the point where it becomes a lifestyle. And then you won't have to worry about bouncing back to where you were before, or falling back into old habits. So you make small sustainable changes. Once you got one of the changes down, then you make another change, and you keep doing it that way until it really becomes a lifestyle. And I've had patients look at me and say, well, doc, it's easy for you because, oh, you're not obese, or you don't have this problem. Well, I'll put it like this. There are changes that I have made in my life over time, such as minimizing the salt in my diet. That was not easy when I started, but it's gotten to the point where I have done it so much for so long that I have adjusted to that, right? And so now it's not as much of a problem for me because I've been doing it for so long that my body is now so used to that change. And that is what I implore you all to do. Make those changes over time. I understand that it's not going to happen right away. And I understand that it doesn't go the same way for everyone. But if I can help you to, implement changes or help you to understand something, to bring about change in your life, that's what I'm here for. Okay? So I'm just going to check to see if there are any additional questions. Otherwise, I'm going to go ahead and wrap up for the evening. So, like I mentioned before, the, you know, the cholesterol discussion, there's always changes, there's always things that's going on, always studies going on. But for right now, if you have elevated cholesterol to the point where you were placed on a medication and you are having medication side effects, because I commonly hear that too. If you are having side effects from your medicine, please, please, please discuss that with your doctor, because there are usually changes that can be made that will help you. So, if you are having any kind of side effect to the medicine and um you are like, I can't do this, or you some of you stop taking the medicine altogether because you're like, oh, I'm not dealing with this, I'm not going to take that. Please talk to your doctor, because the medicine oftentimes can be changed. Sometimes the dose can be adjusted. And so there are things that can be done. There usually are alternatives that can be given in place of that medicine. So, and I understand it takes, for some people, it just takes time to find the right thing that works for you, right? Sometimes it takes time, and there's not really much more that I could say about that than find a doctor that you trust, to have that's going to be straight with you, have a conversation with you about the thing. And if you have questions about it, ask your questions. Don't shy away from asking your questions, because at the end of the day, it's your health, it's your body. And I encourage you to participate in the care of your body. Okay, so you can live longer, healthier, happier, fulfilled lives and stick around for all your family members. I thank you guys so much for joining me this evening. I appreciate all your support. And should you want to book me for a speaking engagement, please reach out to me on my website, www.amizehealth.com, or you can send me a direct message on one of my social media platforms. It's all at Amize Health on Facebook, on Instagram, on LinkedIn, and on TikTok. Until the next time, I will see you then. Have a wonderful rest of the week, and you all take care. Should you have any questions, you can still send me commentary, and I will be sure to try to answer them for you. Okay? Have a good night.